So today our webinar is called Balancing in the Face of the COVID-19 Crisis, Adapting and Reimagining Faith-Inspired Programs. We'll be hearing from 4 speakers that I'll introduce shortly. Just a bit of housekeeping. So we will be recording this session. The video will be posted on the website later. It'll be posted on the same page where the information about this webinar today can be found, and Ruth will post the link to this page in the chat shortly. There, she's done it already. Thank you, Ruth. We invite participants to ask questions through the question and answer, the Q&A function, which is at the bottom of your screen. We'll be looking at the questions throughout the course of the session today, but we'll save them all to answer at the end. So we'll go around all 4 speakers and then we'll answer the questions at the end. So thank you for submitting through the Q&A function and not the chat function. My colleagues in this project, Dave and Catherine, are also online today, and thank you to them for hosting and being involved in many of the other webinars. So finally, I'll just introduce our speakers very quickly before handing over and getting into the presentations and discussion. So we have Nagalan Nasaya, who is the Program Officer for Episcopal Relief and Development based in Sri Lanka. We have Mark Webster, who is a Regional Director at ADRA, the Adventist Development and Relief Agency. We have Michael Coman, who is Director of Strategy at ICM, International Care Ministries in the Philippines. And we have Deborah Boudreau, who is volunteer at Chu Chi and connected to their New York and UN work. We'll be asking, we've set 3 questions for our speakers to answer. Each speaker will have roughly up to 10 minutes, and we're asking them to think about faith-inspired programming in the COVID-19 crisis in the Asia-Pacific region with 3 questions. So what are your new programs and processes that respond to the crisis? How are continuing programs faring during the crisis? And what efforts are you putting in place now to reimagine what will be coming next in the next months and years as we go not so much into the post-pandemic, but just the continuation of whatever may happen as the virus continues to exist in our world. So those are the questions there that we've posed for them today. I'm very delighted to have them all at this session, and I'll hand over now to Nagalan for the first presentation. Thanks, Nagalan.
Thank you, Olivia, and thank you for the opportunity to present today. It's a pleasure to be joining you from Sri Lanka, where I am based. COVID-19 has had a profound impact on the communities in the region, both as an immediate health threat as well as from a longer-term threat to the livelihoods and the health of vulnerable populations, most of whom live on $1.50 a day. Episcopal Relief and Development's partnership model builds on our relationship with local faith institutions in a country. Our model relies on the strength of these local faith institutions. We work with and through faith actors on locally led strategies. So in early March, we reached out to all of our partners with a 10-question survey to capture contextual perspectives and initial plans. These responses gave us a better understanding of how faith communities are evolving their work and serve to inform our accompaniment strategy. The responses affirmed what we already knew about our partners, that faith organizations are trusted sources of information, and churches reinforce their instinct to serve the already vulnerable and already marginalized. This is an important asset that was strengthened in the face of COVID. The responses also identified concerns relating to reaching communities that are not well connected to technology, and how churches who are quick to use their existing assets of infrastructure and facilities are challenged to do so given social distancing regulations. Churches also identified limits to their model, where either tight lockdowns have restricted their ability to mobilize and unload containers of supplies, or where some governments leave little space for civil society to help in humanitarian activities. So across our portfolio, faith actors engaged in 5 main areas. First, timely and accurate information dissemination using appropriate distribution channels. Faith leaders have a permanent and influential presence in local communities and were able to mobilize their networks to share respiratory hygiene and self-care messages. So in Pakistan, churches accessed resources from their local public health authorities and then dispersed these messages across the network of parishes using both social media platforms and print. With most countries in South Asia experiencing the severity of COVID-19 a few weeks later than other parts of the world, we had a very small window to be able to get these messages out widely before lockdowns were enforced. With some partners, a smartphone device or data bundle top-ups were provided to local leaders in remote locations so that lines of communication remain unchanged, uninterrupted. We also reinforced phone trees and buddy systems to cascade information to reach larger groups of people. Second, combating food insecurity through food inputs and direct cash transfer. Churches across the regions acknowledged the disproportionate impact on some population groups and targeted limited resources on these vulnerable groups. In Sri Lanka, the church identified homeless populations, and in India, the church worked with migrant workers to address the loss of economic activity. Procurement bids were received through telephonic or email platforms, and then with curfew passes, trained volunteers, mainly younger members of the church who had less COVID-19 risk factors, ensured that distribution of items or cash grants were implemented in line with physical distancing guidelines. All of these mechanisms will now inform the new normal, even after we emerge out of the most stringent of lockdown restrictions. Third, building on faith-based health infrastructure, local faith actors focused on safety through increased access to clean water, hygiene, and protective equipment. For example, in Bangladesh, the church has a network of health clinics, and using these clinics as a base, the church installed hand washing systems in public spaces, markets, houses of worship, transport hubs, along with the provision of protective equipment to key workers in these public spaces. Procured items for the clinics were delivered through approved courier services, with staff trainings conducted over WhatsApp or Skype. Some of our partners in other regions have also developed short, low-resolution technical training videos that can be easily viewed on smartphones. In the Philippines, the church mobilized village cooperatives to channel lost livelihoods into making personal protective equipment for hospitals and health workers. Fourth, COVID restrictions have increased challenges to some due to the loss of safe spaces, i.e. the closure of schools have made some children more vulnerable in their homes, or the increased number of people confined to their homes have also increased the prevalence of domestic violence. Church-run schools in Sri Lanka and Jordan have shifted to online platforms to not only continue learning, but also to maintain close contact with their students. All of our activities keep a focus on women's empowerment and ensure that children continue to be safeguarded and supported, particularly those in the most vulnerable stage of life. Church partners are also working with communities and governments on engaging a safe house concept, families with whom people can shelter if personal circumstances become toxic. In some cases, we have also succeeded in ensuring church-run safe houses stayed open using social distancing guidelines in those homes. And they are expanding their networks for temporary safe facilities even during lockdown. And fifth, churches have facilitated pastoral care to improve mental health and well-being remotely via Zoom and WhatsApp, and by ensuring those who are participating in outreach ministries are followed up and found through social networks and not left to fall through the cracks. Stay-at-home orders can be extremely difficult for people who are experiencing homelessness or are in unsafe circumstances, such as those experiencing intimate partner violence. Misinformation or the lack of trust in information on how to prevent, control, and manage COVID-19 exacerbates social stigma, stress, and contributes to people engaging in unsafe activities. All of these challenges have a significant toll on the mental health of community members, and we have built on the best practices of faith leaders in West Africa during the Ebola outbreak to develop tools and scriptural studies to address these concerns. And I'll just end by sharing that one of the other key aspects of our post-COVID engagement has been in convening several sector-specific communities of practice with our partners. The communities of practice bring together church colleagues from across the region and the globe on at least a weekly basis through online platforms. We have used some of the top-level COVID concerns to develop a 7-module curriculum for our communities of practice sessions, distributed tip sheets that are contextual to the faith-based structures, and provided spaces for development and humanitarian practices to share experiences and learn from each other. With the rapidly changing COVID-19 context globally, these forums are also an opportunity for staff care and to ensure that we support partner colleagues and practitioners. The safe spaces we create online is a platform for all partner colleagues to seek help, explore challenges, and brainstorm solutions. We acknowledge that we are in uncharted territory. My colleagues are now working with our partners to identify how ongoing development programs are being adapted to be COVID-friendly, using many of the methodologies I just described. Some activities will continue with innovative changes, some activities will be postponed, and then some will be canceled altogether. We anticipate continuing these learning exchange platforms on a regular basis as we move into the COVID recovery phases and collectively learn to do things in new, more efficient ways. Thank you.
Thank you, Nagalan, right on time. Well, what a great 5 examples, 5 areas. Thank you so much. And so now I'm going to pass over to Mark Webster.
Thank you very much. It's great to have a chance to be part of this conversation and to share a little bit. It's a very topical conversation in ADRA. I was a little bit of a late ring-in as a presenter, and so I was scrambling to get some extra information, and I wrote to 10 of my colleagues at short notice with one simple question asking what's been your experience with COVID-19 response and mobilizing the church, the Adventist church infrastructure and resources, and what have you learned from it? And I figured I would get 3 or 4, maybe 5 responses if I was lucky, but in fact all 10 responded fairly quickly and with quite a lot of information. So I'm just going to share a little bit of that. The experience has actually been mostly positive in terms of engagement with the broader Adventist church membership, leadership and institutions in the way that new programs have started up. And in the early stages, a lot of that was focused around information sharing. And certainly ADRA was able to pull together resources, in some cases pool resources, with church health departments or education departments and get messages out to church members and communities quite quickly. But that moved from that fairly rapidly into a response phase, with ADRA being able to leverage its global resources and pre-planning for disaster responses to bring resources from around the region and around the world to stage rapid responses in a number of countries in the region that involved church members in ways that hadn't always been done before. And while pre-existing collaboration between ADRA and other parts of our church was certainly helpful to that, we also saw scenarios where new relationships were established. A great example of that was in Mongolia, where the Adventist church is relatively small, and a lot of ADRA's traditional work and programming doesn't very heavily involve the broader church membership and infrastructure. But in this case, the need in the community was so great that even a relatively small amount of resources were able to leverage a lot of volunteers who got out into the community, identified vulnerable people and groups, and were able to provide resources and support. And that met a key theme of ADRA's global strategy for COVID-19 response, which was love your neighbour. And that really resonated with our church pastors, with our church members, And because their regular work was very interrupted due to lockdowns and being unable to hold regular church services and events, this ability to go out and work in the community was actually something that gave them a sense of purpose, and some of them even described, feeling joyful about this opportunity to get out and to serve others. So we really saw mobilization within the broader Adventist church in three main ways. One was funding, and in some cases that extended beyond the Adventist church. We have a long standing partnership with the Latter-day Saints, who we worked together with, and so we were able to actually combine resources in a number of cases. Volunteers was a second way that we really saw leverage. That was actually a little bit more limited than it might normally have been, just because of safety and security concerns. And so a lot of offices that traditionally use volunteers had to actually scale that back or do it differently, and find new ways to do that. The other area that we were able to leverage quite a lot was expertise. And a new area that has come to the fore in that space is around mental health and psychosocial support and counselling. So in a number of countries where we've got Adventist universities that have psychology departments, or pastors who are trained in counselling, we've seen that there's been some really good new partnerships evolve that have supported both ADRA staff, communities, staff in hospitals, with that kind of support. And I think that's an area that we're going to see growing. I'll touch on it again later. But certainly what we saw was a real shared sense of purpose. With regard to the existing programs, we've found that the key there has been adaptation and flexibility, because certainly they've all been disrupted in some way. Either we haven't had access to communities or to volunteers, staff have been locked down at home. And so there's been quite a lot of flexibility. But one area that was an early emphasis, again, globally for ADRA in this, was also shifting to a focus on care for our own staff and volunteers, who, in an unprecedented way, were also at risk. So quite a lot of our officers focused on that early. We did some surveys early on and found that in our region, in our part of the world, that was really a key focus. And that's included psychosocial support, but also just trying to ensure that people stay employed as much as possible, that they're cared for, that they're looked after. And what we're seeing, I think, is that has had a real positive effect as people are now starting to be able to come back to work. We've probably actually seen a strengthening of the loyalty, of the feeling of being part of an organization that cares. And that is probably something that we'll see good results from going forward. Communication has been the other challenge and key. I think in most cases with our church counterparts and volunteers and connections, we've been able to maintain reasonably good connections. In some cases, it's been much harder to connect with government partners, just because of culture or the way that they're working, or just how busy they are. Touching just briefly on the future, it was interesting for me to see the feedback from my colleagues showing a real sense of not wanting to just go back to doing things the way we had been doing them, to take this disruption as an opportunity to actually learn from it, to reset relationships with parts of our church network that maybe we hadn't worked with for some time or even ever, but not to let that go, to keep those partnerships and new ways of working going. Our office in the Philippines shared that they've often worked with church volunteers and with congregations as part of an ADRA response to a disaster, or as part of regular programming in health or education. But what they've realized is there's actually an opportunity for ADRA to shift from being an implementer of programming with other parts of the church, with church members, with volunteers, to becoming an enabler of those same people. And that's actually an important shift. And it's been forced in this case because ADRA staff are trapped at home. They can't go to places and work alongside people. So they have had to enable. Otherwise, the choice was don't respond. And that mindset has suggested a possible shift in the roles that ADRA can play and the way that it can go about doing its work. It's also seen an emphasis shift towards looking at more local resources and capacity and valuing more volunteerism and what you can do with a small amount of funding and a lot of goodwill and willingness to collaborate. Just the final thing I'll mention, I've talked mostly about Asia because that's where I'm based and responsible for, but our operations in the Pacific have also been quite busy, and one of the things that they've done that was quite unique was to create a set of theological guidance for church leaders and pastors on COVID-19. And it sprang out of a collaboration with a whole lot of other churches in Australia that work together on disaster response. But the version that they've produced, has gone out with the joint support of ADRA and church leadership to all pastors across the region. And it deals with things like COVID-19 is not a punishment from God. COVID-19 does not discriminate. Christians are not immune. Physical isolation does not mean spiritual isolation. Care for those most vulnerable. And God is with us in our suffering. So those sorts of topics and a really sound theological basis for that can strengthen the linkage between the humanitarian work that ADRA focuses on, but also the spiritual work that the rest of the church does. So really seeing some good things that can come out of this terrible situation that's affecting so many people around the world.
Thank you so much, Mark. What a fascinating guide that sounds. Do you think you could share that? Absolutely. Thank you. So I will now pass over to Michael with ICM in the Philippines.
Hi everyone, I'm Michael Coman. I've originally from Australia, but I've been in the Philippines now for 15 years, and I work for an organisation called International Care Ministries, or ICM. ICM works with a group known as the ultra poor. So these are the poorest of the poor, those who live on less than 50 cents a day, and our focus is here in the Philippines. We do this through an interdenominational faith network of around 10,000 active pastors here in the Philippines. ICM runs programs more operationally, I guess, rather than project to project. We have weekly and monthly meetings with trainings in partnership with and through the local pastors and churches. Our core program is called Transform, and it's an integrated community-based training where we select the poorest people from that community, and we gather over 30 of them, and then we have lessons on values, health, livelihood, education, and we teach those once a week for 15 weeks. So we run that over and over again, 1,000 of those programs in a year, over 30,000 families going through that. So it's very much disrupted by this situation that we find ourselves in. We would also meet with our network of pastors, 10,000 of them, but we would meet them in groups of 40 or 50. We also facilitate savings groups, and once again, we gather people together in bigger numbers, 30, 40 people. So needless to say, on March 13, when the President of the Philippines announced a lockdown that ended up extending across the whole country, it basically meant that our whole local workforce of over 500 staff needed to work from home when they were used to being out in the field. All of our programs, which involved gatherings of 30 people or more, which is incidentally almost everything that we had been doing, it all stopped. and even the faith network of pastors and churches that we've been working with. They all had to stop gathering and they all had to stop moving around. So it really put a halt to regular programs for us. And so the first thing that we realized was that the lockdown, whilst helping to contain the virus, it was very strong here in the Philippines. And it had massive ramifications for the ultra poor. There was widespread hunger. It exacerbated existing cases of malnutrition. Now, I think I need to also point out here, ICM is not necessarily a relief organization. Now, we have a disaster response program that we call READY, that we set up in the wake of the super typhoon Haiyan that hit the Philippines 5 years ago, but it hasn't necessarily been a major part of the work that we do. It's simply something that we've used in support of our partners and our programs. However, that is the very program that kicked in at this time. And so over the past 2.5 months, using this platform with pastors sending in requests for help and support, we were then able to send out 9 million meals to 270,000 families all over the Philippines. Now, for the first month of the crisis, we had no option. We really had to work through the local government. Nobody, not our staff, not the churches, nobody was able to participate. There were some areas that were under total lockdown. So what we did is we worked hard with the existing partnerships we had with local government to be able to get the food out to people. And we tried to include churches and pastors as much as we could, but in that first month, it was very much working with the local government. However, after the first month, I guess things eased a little bit, and that's where the church and the pastors really stepped up. Lots of requests were coming in for assistance to not only help them and their churches, but also their extended communities around them. We were able to add other resources, hygiene packs, seeds, PPEs. We disseminated information through these means as well. We gave them guidance for churches behind closed doors. What do you do when you can't meet, similar to like Mark was talking about. And we gave health guidelines, financial advice and guidelines on what to do at this particular time. I think we also realized, like the others have mentioned, that the stress and the strain that the pandemic and the containment measures were causing on staff, and on the churches and the communities. So actually, within the first week, we put together stress management training for particularly our pastor coordinators that are our staff, and train them how to engage with people who were undergoing this huge stressful situation. So then we set up a system where our staff called to talk to and also pray for the pastors. So we were able to do that with thousands upon thousands of pastors, where we just call them, ask them how they're going, ask them if we could pray for them and help them in that time of need. Also, about 1,000 savings group leaders were also able to do that for as well. So our hope with that was that it would enable them to be better emotionally and spiritually, so that they would then be able to reach out and help others in their churches, in their communities, not only physically with food and non-food, but also emotionally and spiritually. We found that a lot of them were very afraid, very stressed, and didn't want to go out. And so we really needed to walk with them through that process. We, in addition to the physical platform of giving out food and non-food, and as well as providing all the emotional and spiritual support, we also pivoted quickly to developing and using digital platforms, social media. We used text, SMS, and so forth. So once again, this wasn't necessarily something that we'd been doing a lot of previously. It only represented about 10% perhaps of our engagement with pastors and people in our network. And it was more a means to an ends with the programs. But over the past couple of months, we've been able to establish contacts and guidance and interact with people through Facebook pages and chatbots for pastors, lay leaders, savings groups. All of these things through these platforms that were either upgraded or even started during this time. I think as we look to the future, we'll continue to leverage off these platforms so that it's not just an added extra, but can actually work alongside very well with the programs that will be restarted again or will be continuing on. So I think that I need to point out here that while all of this has been going on, my team, as a matter of fact, has been modifying all of the program content, all the strategies to make sure that when we were able to restart, that they would have no physical contact, there'd be no mass gatherings, there'd be minimal interaction in small groups only, depending on the measures that are in place in the different locations. And so I think, you know, we've been doing those adjustments and modifications, and we also look to the future in hope that the partner pastors, this faith network that we're interacting with, are also going to see this new normal as an opportunity to adapt, to adjust, to embrace new realities, new opportunities, to redefine the way that they engage with their communities. What I think we won't be changing, though, is our commitment to two very important partnerships who we've always considered the real heroes of our work. So the first is, of course, the pastors and the faith leaders that we partner with will continue to do that. The second would be the partnership that we've had with local government, the public health system, including rural health units and hospitals that have been really hit hard during this time and have been carrying the load, particularly with the health crisis. So we'll continue partnering with them. Let me just finish now by saying that I think there's a couple of challenges that we're likely to continue facing in the future because of COVID. Firstly, I think we acknowledge the difficulty of having to reposition and retask a large local workforce with the programs in ways that are very new. That change management is going to be quite difficult, so that, you know, people are more equipped and more used to doing things digitally with no contact and socially distant, gathering in small groups rather than facilitating larger groups. So that change management is going to be important. The second thing, I think, is we know that continuing to negotiate the effects of what Thomas Puyo called the hammer and the dance is going to require us to be on our toes, to be agile as an organization and help the network and the churches to be agile enough to adjust to back and forth and ups and the downs and the unpredictability of the coronavirus, and I think the way that it's going to be managed locally, that we're going to need to be agile and be ready to be able to respond and adapt as things become more clearer as time goes by. I think also we know that as development organizations, our work is cut out for us. The hammer came down and it continues to have really significant consequences here for the nation of the Philippines, and particularly the poor. So there's now higher employment, more business failure, economic collapse, and millions more are slipping into poverty. So we're going to have a lot more work to be done. And so we're going to need to not only be agile, but we're going to need to push through and persevere and look for funding opportunities to be able to face these challenges. Thank you, Olivia.
Thank you so much, Michael. Yeah, very interesting to hear how how lockdowns are so different between country to country, basically, and the specific experience in the Philippines. Okay, and I would remind everyone that after Deborah speaks, we're going to have question and answers. So please start to put your questions into the Q&A at the bottom of the screen. So thanks, Michael, and let's pass over now to Deborah. Deborah, over to you.
Thank you so much, everybody. And thank you for the panelists sharing such a wonderful, important information from different countries. Please allow me to share with you the overall perspective of what Buddha Tzu Chi Foundation, the whole team, all the silent heroes behind the curtain to deliver the services. In the face of the suffering that COVID-19 started, Buddhist Tzu Chi Foundation around the world have been at the front lines of responding to the impact of this pandemic, ensuring the most vulnerable populations can be served and no one left behind. So Buddha Tzu Chi Foundation mobilizing its global volunteer network and work it out with the partners around the world to provide food security, medical assistance, and PPE to the communities critically impacted by COVID-19. Tzu Chi stands committed to elevating the suffering of those in need, putting the Buddhist principles of compassion in action, and adapting to unique challenges brought upon by COVID-19. We know COVID-19 going to be turn our world upside down. As the COVID-19 pandemic continues to spread, Dharma Master Zheng Yan, the founder of Buddha Tzu Chi Foundation, appeals to all in prevention of COVID-19 as we safeguard our own health and communities. We should reach out to the vulnerable communities in this unpredictable time to spread love, overcome feelings of resilience, of restlessness, and bring communities together. Try to bear with me. I'm going to share with you number. As today we use social media, we use a lot of accountability outcome indicator. Let me share with you the number that we are doing. Currently in Asia, Tzu Chi reached out 22 countries. In American continent, 15 countries. Europe, 17. Africa, 12 countries. Totally, COVID-19, Tzu Chi has been provide PPE support to 66 countries. There are another 17 countries who we are facing for transportation challenge and a lot of coordination, customer requirements. So we are trying to overcome those challenges, but we do have a very strong confidence we can do that. The COVID-19, Tzu Chi implement a project called Great Love, Good for the Good. There are existing 50,000 families in Indonesia. We continue provide the services. Second area we focus will be mental health components. Third area is financial assistance. Fourth area we call emergency cash for work report. Number 5 is medical assistance. Number 6, scholarship, education, tuition, social media intervention. Number 7, housing, roofing. So many projects that we are trying to work with it. Tzu Chi is committed to work with all the partners, such as through the communication, the critical risk information, and influence personal behavior change through the positive information to share. We work with WHO, we work with UNDGC. Number 2, to provide aid to refugees and reach the unreachable population. We work with United Nations, UNHCR, and IOM. Number 3, we work with UNICEF to provide women and girls education and job skill training. Number 4, we work with OCHA, Global Humanitarian Response, to work it out, mitigate collateral food security and livelihood impact. Currently, 实际, overall the number, we provide 17 million items of PPE donated to 66 countries, including hospital, frontline workers, school, faith-based community, including Mother Teresa compound in India, which we never think about we can do it, and working with Indonesia government to provide food to Muslim population, to provide medical assistance, and then food security in Philippines. So across the 6 continents. The most important right now is not just delivery the PPE. The most important is how we're going to look forward, build disaster preparation, and face the climate resilience. 实际 trying to serve with compassion, working with relief, serving with relief. So we try to building solidarity among interfaith and Buddhist leaders, and building coalitions of compassionate mutual aid to ensure that the most vulnerable receive the help they need. The gap, what we see right now, the knowledge gap. The knowledge gap on collaborative behavior change need to mitigate future zoonotic disease outbreak. How can we transition our culture away from excessive animal agriculture toward to sustainable living? The midterm challenge is transportation infrastructures to ensure aid comes to the unreachable. Those are the key area we really would like to share as we approach the hurricane seasons and climate uncertainty. How we're going to work it out together as a team, which is very critical and important for all of us right now. As a Buddhist, serving with compassion, relief with joy, 慈济 try to work as a group. And the most important, we are not trying to work alone. We are trying to build it up, the partnership, the collaboration. So it is very, very important for every one of us. If we have time later on, I'm going to share with you 2 countries, Indonesia and Philippines. And if we have time, we can share with Thailand what kind of operation we in place and how can be so successful to bring government, civil society, private partners, faith-based organization into one table to provide the COVID-19 relief effort at the same time to look into the long-term recovery. So thank you so much.
Thank you, Deborah. Yes, it's great to hear as well about this future idea of how this is interconnected with everything we should think around about climate and collaboration on those efforts as well. And I think it would be great if in the questions that we'll go to now, if we could hear a bit more about maybe the example in Indonesia and others. So please put, if you have questions, put them in the Q&A. Our first question, or in fact our only question at the moment, so you have a lot of opportunity to ask more, is about the challenges of the lockdown. And we've heard a little bit about that already, but I think it would be fair to ask a further question to any of the speakers that would like to talk about the impact on livelihoods, the reality of development programming connected to livelihoods, and how we support those kind of programs through the faith networks and through the work that we're doing already. If there's anything to add on lockdown impact on livelihoods and work to support that, I'll hand over to anyone that would like, any of the speakers that would like to say something on that.
This is Deborah. I would like to share two cases, two situations we face. Number one just happened recently. When I share with India, we all know India lockdown, and then everything has been totally, no way, you cannot reach out to anyone. Tzu working with the Catholic community for a long time. And this time, COVID-19, we talk about all the time, the challenges also turning to the opportunities. So we receive approach support from Mother Teresa compound. And they say, we have more than 200 sisters inside the compound. We are really short of food and we have no PPE and no way for us to go outside. So this information comes down to us. And then, you know what? The best friend called Google and social media. So we just established our partnership and trying to understand. Remember, I shared with you so many numbers. Those numbers are behind. That's a channel of love. Without compassion, you will not make it happen. So immediately, we got support from the UNDGC, the board member, and he said, I'm in Canada. I know somebody in local Calcutta, and they have some food support needed. I can help you. But we have problem because like our panelists sharing, no way for funding transportation, especially the support from outsider. So he just say, do you know, I can help. I can help. I have family member locally. I can use my local connection to help you to bring the food, to bring the PPE, the mask to the compound. The compassion make it happen. Within 1 week, we provide the financial support. Jack Ray in Canada make a phone call back to India, Calcutta. Calcutta, the local community mobilized. So they find where's the food. They find the rice, they find the doll, they find the PPE and deliver it to Mother Teresa compound. And you know, in USA, everything document. So when we ask them to sign document, they say, we don't have a printer to print it out, whatever you want the documents. So that's number one. Number two, when we receive their request for support, we try to call back. They use WhatsApp to communicate. So we try to call them through the WhatsApp line. No answer for 3-4 days. So we are wondering what's happened. Is that the real request for support or something happened? So when the local team deliver the food to them, they say, we don't have a telephone. So the local, a lot of communications, that's a lot of factors. We are always using the Western world to think about the local grassroots situation. So the lockdown, really this time, we can overcome. Number one is compassion. Number two is connection. Number three is devotion. And number four is motivation. This is the number one case. Number two case is Indonesia. Indonesia is a Muslim country. April 24 is the first day for Ramadan. And something happened. Government shut down everything. And people, they cannot go home. Everything stands still right there. What are you going to do? So many homeless just try to find a place. So now the volunteer networking, church position is so critical. So lucky enough, we have our stations in Indonesia, in Calcutta. So our volunteer mobilized. But again, it's a lockdown. How can you deliver the food to them? So they work with the local government. And very grateful, the local government know who we are. So lesson number one, we have to work with the local government during the regular time. So when something happens, they know you have the capacity to deliver the services. They will inform you, say, can you help? So Indonesia this time, I don't know whether you remember a long time ago, there's a very strong racial situation between people against Asian population in Indonesia. So from that point, Tzu Chi started to build it up, repair the relationship. So it's been for more than 20 years. Now this kind of relationship slowly being recognized. So now an Asian with a Buddhist try to deliver the food to Muslim, they accept it. And they are at the same boat, feel like they are grateful and they have somebody to care. So this case is partnership. How you're going to work with the partners together during the regular time. So even the lockdown, that kind of activation, we cannot promise you can do everything, but at least you can secure certain area and to do control management, to provide food, basic needs, livelihood, to secure the safety environment and community. So that's two cases I would like to share.
Thank you very much, Deborah. And also two cases that talk to one of our questions about interfaith partnerships. So that was great. Lots of opportunity for new interfaith partnerships. I'll hand over to the other speakers to, we've got a few minutes left. A few questions have come up around the effects of COVID on mental health, the effects of COVID on funding available from governments and foundations, and then the effects of COVID on domestic violence and lockdown. What I'm going to do is maybe ask each of the speakers I'll go to Nagaland, then Mark and Michael, to pick up on any of those questions just as we come to the end, and we'll do, feel free to answer any of all of those questions at once. So Nagaland, I see you're unmuted, so we'll hand over to you.
Sure, I'll answer a few of them. A common thread that we've seen to date is that COVID-19 and its secondary impacts are accelerating inequalities and threats that were already present. So in terms of livelihoods, if income is based on street sales, on micro entrepreneurship and transport, like the income of so many vulnerable populations who live on the margins, then the only solution may be to see them walk back to the farms and food production areas, which are already struggling to produce and not be able to receive them. And these challenges are immense, but our faith partners are equipped to respond to the immediate needs and support communities in the development of safety nets to lessen the secondary impacts of the pandemic. And again, building on their reach and their trusted networks to execute immediately. Churches identifying income generation investments that honor social distancing and contribute to health and safety needs. And then they issue direct cash transfers to empower vulnerable households with purchasing power and lifting up the local economy to provide food seeds and food preservation inputs. We're also seeing, after this immediate phase, the opportunity really to build disaster resilience strategies. So the activities linked to existing community and government resources to complement rather than replicate service delivery. So once we enter a COVID recovery phase and the time is appropriate, we can support faith and other community leaders in the mapping or remapping of locally available resources and assets. And we can maintain those multiple connections for future disaster responses. On the mental health question, during the 2015 Ebola pandemic, our responses included a combination of using existing assets and development assets to provide, sanitation, hygiene, protective equipment, all that stuff. And the response efforts engaged faith networks and their leaders to influence change in behaviors and practices, that given that they were more trusted sources of information. So this addressed stigma, stress, disruption in traditional funeral practices, all that we see now with COVID. And so messages built upon the trust and confidence communities had in their faith leaders in their respective communities community health agents or savings group leaders, major stakeholders were mobilized to take on this added role as key frontline workers in this fight. And we were able to rapidly respond to this, leveraging these existing relationships. And then on the final question on interfaith partnerships, the faith actors are relational and we build on existing relationships. And so through these various outreach ministries, interfaith forums, and through the youth and women's networks, these ministries have been mobilized and their cohesion was enhanced. And we see that these relationships have only strengthened after COVID. So I'll end there.
Thank you very much. Over to Mark and then Michael. Any final thoughts on these questions before we finish?
I'll build from what Nagulan has shared and focus mostly on mental health. I think it's too early to say what's happening with funding. At the moment, we're getting more than we were before, but that may not stay that way depending on how the economic fallout goes. But I think mental health has an interesting tie-in with faith and faith traditions and faith practices, which have always had an impact on people's mental health, mostly for the positive. But many of those traditions have been challenged by particularly lockdowns, but will continue to be as lockdowns are eased, but there are still restrictions on the number of people who can come together and in what circumstances and in what ways. Just within our own set of staff and volunteers, we've been able to run some webinars for mental health and building emotional resilience. And at a time when people are experiencing webinar and Zoom fatigue, those webinars are always overbooked. We're always at our maximum Zoom limit of 100 participants because they are just so in demand. And I really think this is a space that as development organisations, but also as faith organisations, there's really an opportunity to step forward and do a lot more.
Thank you, Mark. With a minute to go, Michael.
Sure, I'll keep it short and sweet. Let me just briefly comment on the funding element. So very early in, nobody wanted to talk about anything other than COVID and the funding for that. So all of the other proposals that we were working on, all of the dates were getting pushed back, and nobody really wanted to talk about anything other than what are you doing about COVID. So we really had to engage on that level and talk about the existing programs that we had that were addressing those things, how we were pivoting, how it would affect any of our upcoming programs. The other thing that was interesting to us is that, I mean, we had already been working very hard on community health workers in that space. And so that became a real generative area that needed a lot of attention during this time. And so, yeah, it was, we just basically had to shift all of the proposals and make sure that it brought COVID into account so that we could, seal those deals and be able to move forward with more confidence. I think, for us, we have been able to flourish in this circumstance, and we're thankful that, that funding hasn't necessarily been a problem for us as an organisation. So, thank you, Olivia.
Thank you. Thank you so much, everyone. We're on the hour now, so we're going to bring it to a close. Thank you to our attendees and your questions. And thank you to all of our speakers. We've learned so much from so many different countries about the differing impacts of the lockdown, the different ways that faith communities are stepping into positions, the different ways that you're working with social media, other communication devices, the crucial role around mental health and spiritual support. It's been a really a wealth of information and sharing. Thank you so much. So we will have this recording on the webpage. We will be able to share resources from the organizations if they're not already up already on the resource repository. We look forward to the next webinar, which will be later on this month in June, where we'll be looking most likely at Latin American countries, maybe particularly Mexico. So thank you so much, everyone. Have a good rest of your evening, afternoons, mornings. Bye now.